teams and so on. So that was also pretty important to us. And pretty soon we saw that this is a good opportunity to bring research and MIS closer together. And I've noticed in a lot of places where I've been that the two are often working completely independently from each other, often doing somehow overlapping work and not sharing the data that they have. And the training that I provide will often bring together researchers, MIS officers, maybe IT people as well, and maybe a couple of program managers or sales and distribution supervisors. So it's really a good way to bring those different groups together and help them to improve data sharing, even just internally. That seems to be a big step in many of these places. Now, a few examples to start with here. We're looking at Tanzania. They're actually one of the pioneers in this Google mapping. Before even there was talk about this project, this is a map that was generated about just over a year ago. This is a map that was done by their rural engagement teams who go out to all the villages and conduct MVU shows or have community meetings, all different types of interventions. And well, the blue lines, they also have this GPS, the car tracking system, Geotab I think it's called, which they can upload onto Google Earth, so they can see both where their teams, this is the area that was covered by one team in 1 month, so in southern Tanzania. And those teams, they've got GPS units, so each time they go to a village, take the coordinates, have a small form, and I can see that in this, where there's a TV here, it tells me that this was an MVU show that was conducted on that specific date in this Naliendele village, which has 2,300 people, and Chief Chinambatata with that telephone number said that due to the Under 5 campaign, decreased the death of children in my village, and treated net are used effectively. So Tanzania saw that there was some utility to this, not just to have a nice map and look at the data, but to see, well, did our teams cover the area that they're supposed to cover? After a few months' time, which are the areas that they haven't covered? And maybe we can use those maps to send them out to another district, or shift the focus on, maybe they've done lots of MVU shows, maybe we need more of these community meetings, or whatever they're doing in that specific area. Now, I have to also mention Mozambique, where I think the first Google map with PSI data that I saw dates back to 2005 already, which was under Brian. I think he'd actually just himself took some GPS points and mapped out some of these outlets. So the tools have been around for a few years, but it's only recently that people have seen the interest, the real opportunity there, because they're so easy to use, and hopefully that's something that we'll see in the next session. After this, we have a technical training on how to bring your own data into Google Earth, just similar data to this here. Another map, maybe, this is condom availability in a high-risk area, a hot zone as we call it. This is typical map data, which people often have trouble mapping and sharing, and we have reports with some small blurry maps that are not that user-friendly, not always very good-looking. And just by getting your data onto Google Earth, you get the nice background image. You can see the streets and the roads and all the buildings, and can, in this case, see, I guess the green ones are those hotspots, bars, venues, and small outlets around where PSI condoms are available. Yellow ones, I think, were other condoms, non-PSI condoms, and then the red ones, those are places that currently don't have condoms available on site. And again, you could zoom in. This is a screenshot, but you could zoom in and click on a point, get the name, get the address, use this to send out your sales reps, if that's the way, if you're into direct sales still, and use it as a day-to-day planning tool, not just looking at nice dots on the map. So that's from our Tanzania program, typical map data. Some of you may have come across a recent map report from Laos, which was the first report to actually use Google Maps in their report, and they had live links, so you could actually, in the annex there's a whole list of links, so you could click on one of those links, takes you to a Google Map website that shows which places they visited, whether condoms were available, how many sex workers are present, and so on. Obviously not available to the general public, because some of the data we want to keep to ourselves, and there are confidentiality issues and so on. So we'll see that there's different ways of sharing your data. Another one here, Ethiopia, another one of the pilot countries. They've been doing a lot of work through public and private sector facilities. Specifically, they had a big UNICEF project under which they trained what they're called health extension workers in basic health posts. And they've been providing ITNs, kits. And for example, this one is in Addis, that shows for each facility, Black Lion Hospital, a government hospital, how many kits, ITN, with or without ITNs, they've distributed, who's the area supervisor. This is another nice map, I think, of a town in the north, Bahardar, near Lake Tana, where they've mapped out, probably